expecting loads of people today, so I think it'd be a really nice informal chat. So we have our speakers first, and then we'll go on and we'll have a think about some questions. I know we've got an audience member, Hannah, who'd like to talk about some of the work that they're doing. So yeah, it'd be nice informal. So first of all, I'll pass you over to Ranjita, who will introduce the SIG. So Ranjita.
Hello, everybody. It's well, good afternoon or good morning, depending on where you are. Really, really lovely and welcome, to everybody who's joined us. And I'm going to share my slides. So we have Sandeep and Ameet, and I'll present an overview first about the SIG and a little bit about our own creative practice, what we do, what I do, what Ameet does, and what Sandeep does, and then this will be followed by some questions and some general discussion. And we also have some information about a research project you can join. That's Hannah Waterston, who's based at Manchester University. And I think a couple of her students have also joined this session as well. So I hope you can see my slides. I'm going to share that now.
Yeah, we can see that, Ranjita.
Excellent. I'll go into slide mode. Excellent. Okay. So thank you very much. And thank you very much, Alex, for setting this up and coordinating this all. And I want to say, we did have our creative health pharmacy SIG previously, and so we're a bit quiet, and I'm so pleased that we're relaunching this. But how did we actually start? We started as a group, and we emailed each other. We did it very informally, and we held online events, and it was. And I was really pleased that we are now supported by the National Centre for Creative Health, because we are now hosted by the NCCH, and that really kind of makes us connected with what's happening nationally in terms of creative health in the UK, and also connects us with things that are happening globally as well. So really pleased that the NCCH are supporting us. So the people we're going to today be talking about our SIG, a little bit about my creative practice, and Ameet, and I'm based in the University College London, so I'm an academic there, and also my research is in public health and connects arts and sciences. But I'm also a pharmacist. I used to work in addiction services and also in public health. And we have Ameet Vaghela, who is the lead clinical pharmacist in Shoreham Health Centre, and also Sandeep Pahal, who's a senior principal pharmacist in medicines optimizations in the Black County Integrated Care Board. So warm welcome to everybody, and thank you very much. So the SIG really, over the time that we've been together, and as the work of creative health has evolved naturally, our vision has been inspired by what's been happening in the UK. So really, looking at advocating for creative health, that's really our vision. And this is in the realm of practice, in education, and research culture. So really kind of encompassing all the different areas. And our aim is to be a very dynamic group. This kind of creative health is a really kind of dynamic thing in itself, and we want to be really connected with the current activities, and we're really interested in innovating as well. So yes, how can pharmacy practice be more integrated and connected with the arts, and how can that enhance practice experience for practitioners as well as patients, and about our education, our curriculum, what needs to be amended and changed and enhanced through the arts, and how can research culture flourish in a way that beyond what we currently do, and also looking at policy development, how does that then inform our policy. And so that's UK and sort of the global scene. So we want to share knowledge and ideas, what's happening globally as well. So this is sort of a list of things that what we are exploring and how we'd like to work collectively with. So we are aware that creative practice is happening, in different parts of the country globally, and we're aware that this hasn't really been connected. Maybe I think a lot of this is happening in isolation. So it was really important to create this special interest group, and I think we might be the only special interest group in pharmacy in the world. If there is something else that you know of, please let us know, because that's why we need this kind of group that we are together. We know what other things other people are doing. So sharing and advancing is one of our kind of goals of what we want to do, and also integrating where in creative health, how practice and education and research policy are integrated, and where creative health exists in all those realms. It's not just happening in practice, but it's also in education. So we're really kind of sort of connecting and making it into not an isolated event, but something that is running throughout. And we're advocating for change as well. So a lot of our work is a form of activism. It's something new that we're doing, it appears. And also we're looking at ways of thinking in an interdisciplinary way. So when we talk about arts, it's not just about painting and drawing. It's also things to do with nature, dance, music, cooking, lots of things. And there's a definition about creative health that the NCCH has, and then we can maybe put that on the post for you. And also cultural understanding, developing new ways of looking at arts and how we can have that in pharmacy practice and pharmacy research and education and policy. And also we thought this was really important, number 5, well-being of practitioners, people we work with in our teams, the pharmacist, the pharmacy team, and also other workforce, diverse workforce. As pharmacists, I'm a pharmacist, I don't clinically practice, but working in different sectors and industry, and looking at our well-being in different ways to probably what we've done so far. I know that during COVID-19, pharmacists and their team were visible, we were open to the public, and we did so much in that COVID-19 time. And I think the stories and what happened hasn't really been fully kind of shared, and it still remains unknown. And I feel that our well-being is not something that we do privately. We share and we advocate for it, and we express our needs for well-being and what we require. So and then that links with our professional development as well, and making it a more of a creative learning experience for pharmacists, something that gives us joy and motivation in our work, that keeps us going and makes us feel like work satisfaction, and takes us back to the reason why we chose to become a pharmacist. So details of this is on our webpage, and I think we'll put that on the chat for you. You can read about our terms of reference on there. So we have some exciting news. We are creating a steering group. We used to have like an informal group before, but now we would like to invite like a more of a formal steering group, so that we can really advance the work of the SIG in a more of a ambitious way than we've done recently in the past. So people who are here and others who are maybe interested, please share information about this. And so what will it involve? If you are interested to become a steering group member, we expect you to be quite sort of active in the sense of attending our meetings, contributing to our meetings, possibly holding one online event a year. So in our steering group, we'll probably have about 4 or 5 people. So it's so we'll have they'll be running other events themselves too. And there's something about arranging an in-person event. This doesn't mean that you have to do something outside your work. This could be something you're doing in your work. For example, if you're working in a hospital and you decide to create an in-person event for your team, and that's great. And if you did that, we could support you as the NCCH SIG about your planning, your thinking, how to kind of add creativity into your activities. So we're kind of really wanting to do this to support you, so it doesn't have to be a standalone thing. But in the future, we could do like an event just with the SIG where we all meet in person. So online mainly, but on sort of in-person events are very much encouraged. And so our meetings, we will be holding like 4 meetings per year, once every 3 months. And in future, we could have lots of activities, perhaps have our own newsletter, do a research project together where we scope the evidence, publish work, not just in traditional research journals, but other creative outputs as well, and make our work more visible to diverse audiences and the members of the public. So who can become a steering group member? Anybody from any sector of the pharmacy workforce can become a member anywhere in the world. Also, you can be a health or a social care practitioner, a creative practitioner, an artist, students from academics from pharmacy and other settings as well. And also, we very much encourage people with lived experience of illness, of being a carer. Policymakers very welcome. Anyone interested really in developing creative health for pharmacy. And we believe that it's really important to have a really diverse kind of mixed group in order to do this very interdisciplinary creative kind of group. So I can see Alex has been sharing the links for our webinar and the different terms of reference that I mentioned. So to apply, please send your CV, maximum 2 A4 pages. Please don't make it long, and a cover letter outlining your interests and why you think you'd like to do this. And please email this to Alex in the email here, which we'll put on the chat. And this this presentation will be shared with everybody who's here, so you'll have this information, these slides. And the deadline is the 20th of March. So looking forward to receiving applications from you. So I wanted to kind of pause there to ask if anybody has questions before we talk about each of our creative interests. Any questions from anybody or thoughts? If
anyone does have a question now, you can raise your hand if you want to, and then we can enable your audio, or you could put the question in the chat and we can come to it later if people just want to mull that over. And I'll hand back to Ranjita.
Thank you very much. So we all promised you that we would share our own creative practices, and I'm so pleased that Ameet and Sandeep will do the same. And I'm just going to, oops, there we go. So a little bit about me. I could have mentioned it at the beginning. I am a pharmacist, registered but not practicing. So it was when I was working as a pharmacist, I didn't think I'd go into academia or research. I really loved practice. I really enjoyed it, and but I also became very interested in research, and it was through looking at how I could improve pharmacy practice. So my PhD is actually related to how pharmacists could talk to the public about their drinking and why we don't have such a service in pharmacy when we meet people with mental health problems and drinking all the time. So I was, out of curiosity, I went into academia, and I was very interested in other areas of research, not just sort of alcohol harm, but other forms of public health, including health architecture, about health spaces. And I'll talk about how I connected that with pharmacy in my next slides. And I'm also interested in global health, and I bring creative methodologies into global health, and I'm doing a few projects in Nepal at the moment. And I'm also a visual artist. I sculpt, and here are some images of my sculptures and paintings that you can see. So so I have a kind of a mixed arts and science background naturally, so I needed to be, so therefore I'm in the arts and sciences department here at UCL, so I feel very at home here. And I wasn't always in this type of department. I was looking for a space. And so why did I get into this study about health architecture and space? It was really from doing my public health research, I realized that how little care and attention had been placed on our pharmacy environment and spaces where we work. This is a community pharmacy from a research publication of a consultation room. And you can see that table, those chairs, or how it's so cluttered. And it's got the title, A Convenient Space or a Tight Squeeze, the insider views of the community pharmacy. I know not all pharmacies look like this, but in my research and when I was working, I did come across quite a few spaces that looked like this. And it really struck me that our kind of, for us pharmacy practitioners, learning about our sensory experience, and our kind of focusing on our senses and our patients' embodied experience is really absent in pharmacy training and practice. And that through its absence, it has resulted in working in this kind of space, and this is becoming normalized. So it really kind of surprised me. And so I went about exploring, how could the spaces be made better? And also, how is it that we have spaces like this when now pharmacists are all going to be independent prescribers? The course has already happened. I think we already have graduates coming this summer who are independent prescribers. So the whole of the pharmacy landscape clinically is changing, but our space hasn't. So in response to that, I started this research called the Architecture of Pharmacies, and through this we've published a systematic review on all the publications around the world that have looked at pharmacy spaces and what patients and staff think about the spaces, to give us ideas to build on this work. And we had and in order to kind of just develop this discourse and start talking about it, we held an exhibition called the Counterculture Exhibition, which said that was the name. We like the counterculture, and it was a really lovely event at the National Centre for Creative Health. We're also part of that, and we had people from the NCCH join us and talk about their work, and just giving you some images of that. And also we were part of the London Festival of Architecture, and I think that was the first time pharmacy has been involved in terms of exploring space as part of the LFA event. And in order to kind of develop such a project, it needed to be really interdisciplinary. So it wasn't just pharmacists talking on their own. It was myself with architects, pharmacists, people with lived experience, academics who were pharmacists, but also looking at history and design. We had student Eloise there. She's a creative health master's student from my department who was an intern for this project. So we had some really, stimulating, really fruitful discussions about this, and that led to the design of the study. And here's an image of one of the events. So we held a series of events, and also we had displays. I don't know if you can see at the back, we created these display boards of the different questions and activities about exploring the idea of pharmacy space. And it was a really rich kind of conversation because of its diversity. And also we had one of our collaborators, Purple Stars, and Purple Stars is based in the University of East London. They're part of the RICS Inclusive, and the word purple means it's a colour that stands for is associated with economic power and disability. And the STARS stands for Sensory Technology Art Resource Specialists. And Sam, you can see, she went to visit few of the pharmacists, and her own pharmacy, in fact, with Joseph, who was part of the study team, and she did some drawings, and she felt that the pharmacy could look much better if it had art in it. And she talked about her experience of the space, like if your talking isn't great, pharmacy counter can be a scary place. I feel more respected if pharmacy staff can look at me when talking to me. That's what she expressed, and other things as well. And the music that plays when you enter the pharmacy is fun and makes me feel welcome. So her ideas, and we in this display we had these the chopper. These lollies, I can't pronounce the name, Chupa Chups, I think. And why is it we have all these archaic items in the counter? What does it mean? And sometimes it's fun and it's bright. It doesn't mean that we have to strip everything away and make everything white, but humanize it. There's elements of community aspects that make people feel warm and welcome, handmade, human-made objects and items, and therefore designed to engage in that way. And Sam was really kind of important in our exhibition because she decided to draw pictures of her medicines, some pills, and I don't know if you can see here, but she drew 3 or 4 pictures of her pills, and we kind of duplicated it and made it into kind of big. We incorporated that design in many things. For example, we made them into cushions for the exhibition. So this was repeating the pattern of these pills, these tablets, into like a larger kind of like collage. And we also made a bear, and then we gave that to Sam to thank her for her artwork. And in the exhibition, and it was a very kind of community engaged exhibition, people expressed what they thought about the space, how pharmacies should be, their experiences of visiting the pharmacy. So we covered a lab coat in these ideas and artwork. And I forgot to mention the event took place in the Bromley Bibo Centre in East London, which is one of the first places where social prescribing was launched. So it was a very special place, and it's a community centre where they have a GP surgery, a cafe, I think there's a nursery, and it's a creative space for art practice and creative practice. So you can see other people here. You know, it's really lovely. People who had never been together, who were artists, pharmacists, members of the public, other health practitioners, architects, designers who'd never really spoken to one another, came together to talk, and the conversations were really delightful. So it's going to finish here. For me, I just wanted to say, you know, when we say creative health and creative research methods, it's not something that's new. It's been going on for a long time in many disciplines. But this interdisciplinary approach of bringing it together is a new and exciting thing. And I want to say many scholars have engaged with this creative practice, and there's a lot of evidence for this. So we're not having to invent something from scratch. We're actually applying what we already know, and we're applying it to pharmacy, which is a really exciting and dynamic thing. So thank you. I will end there. It's to say that please do sign up for our NCCH Creative Health Pharmacy SIG to be part of our mailing list. And also, if you're interested to apply to become a SIG member, please do. And this Architecture of Pharmacy was supported by Pharmacy Research UK Leverhulme, was awarded to me as a fellowship, and also the UCL East London Seed Fund as well. So thank you very much. And now next will be Ameet. Thank you, Ameet.
Hello, everyone. Thank you so much, Ranjita, for allowing me to speak today. So my name is Ameet Vaghela. I am also a pharmacist, but I also happen to be, as you can see, a poet, an artist. I love folding paper, and I seem to be a master of emotional intelligence. So if I could have the next slide, please. I'm going to give you a little bit of not really a CV, but a little bit about me. So I've been a pharmacist for about 27 years. I qualified in 1999, and I've been working in different areas, and I think that's made it quite an interesting journey for me. So I started off in community pharmacy and then moved over to secondary care, sort of doing rotations, medicines management. I held a job in A&E. But it was just really from 2015 onwards when my life changed so much, in the sense that I was working in very stressful environments. And if you look at from 2015 onwards, I was a respiratory pharmacist in North London at Whittington Hospital, where things got a bit scary coming up to 2020. I was under a lot of stress when the pandemic started, and I moved to Brighton in 2020 as the lead respiratory pharmacist at the Royal Sussex County Hospital. I stayed there for a year and a half and moved over to Ada Health Partnership, where I currently am their lead clinical pharmacist, and I've just accepted a new job going back to the hospital, and this time as a high-cost home care services lead pharmacist. The slide that I'll have next will show you the elements of where I needed to look after myself during times when it was very, very stressful. Thank you, Ranjita. So 2020 was a year of new things for me. So I'd moved from London to Brighton. I didn't know anyone apart from my husband who lives here. I started a new job. The pandemic just kicked off. It was incredibly stressful at work, and my father-in-law died. So there was a lot happening on my plate. And if you can just tap down a little bit, it had an impact on my physical and mental health. I happened to glance at the Pharmaceutical Journal had their annual writing competition, and they felt a Brave New World theme was apt. And if I could have the next slide. it takes a little bit of while because of the animations that are coming through. So their writing competition came along, and I was really lucky because I wrote a poem called Staccato, which was renamed for the journal as COVID-19 by the Sea, but this is no holiday. I wrote this on a bus journey within 45 minutes. And I think looking back, the reason I did it in the way that I did was I needed somewhere to vent. And if I wasn't looking after myself, I couldn't look after anyone else. My poem ended up being one of the 5 finalists for the writing competition, and I was really proud of it. It was my first bit of poetry and opened up quite a lot for me. Thank you. In not just that it was printed in the journal, but also that they asked us to record us saying our poem. So I'm immortalized now on SoundCloud and Spotify on the PJ Pod, where I was able to speak to my poem. Looking back and talking about it now brings back a lot of the memories, and not in a particularly, well, in a positive as well as a sort of difficult time. A lot of pharmacists and technicians reached out to me to say, you've somehow encapsulated how we felt, what it was like working through that time. I was also really fortunate because this was taken up by writing organization called Covert for their launch magazine, and they are a Sussex-based people of color writing community. And at the same time, the Pharmacists Defence Association LGBTQ+ forum also reached out because they felt this was really important for pharmacists to know about it. So this was my proudest moment, I think, and in a time when I needed venting and was really important to get that message out. If I could have the next slide, please. So thank you. I worked at Barnet Hospital, and at that time I had a job in A&E. I worked together with Heidi Edmondson, who was one of the A&E consultants, and we felt that actually this is an area where staff were incredibly stressed. It was very busy, and she knew that I liked folding paper. Origami, for those who don't know, is the Japanese art of paper folding and has been seen to have benefits for mental health and well-being. We thought, why don't we take some of the staff away for 10 minutes at a time, take them away from that stressful workspace and just fold something very simple. So there's pictures there of Japanese cranes that we used. It allowed the staff time somewhere different, away from patients, away from just the hardship that can be A&E. And this predates the pandemic, and I felt that it was a really good way of the staff to connect, do different things, focus in a completely different way. Of course, it didn't mean that A&E services stopped at the hospital. We actually did have an arrest that happened at the time, and everyone jumped to action. And it was, it was really wonderful to see how, for a few minutes, the staff were able to have a space, just somewhere where they could just be somewhere different. And then this goes back in time to when I worked at Barnet Hospital. So if you can stop there, thank you. So what I noticed when I worked in Barnet Hospital, so at that time I was their senior clinical pharmacist, and I was going into my A&E role. And I noticed that actually it was really busy. Staff were feeling very low. They complained a lot. They felt that they didn't really like where they were working. Motivation was very low. We noticed that there was a lot of errors that were coming through dispensing, which meant that they were working longer hours. And actually, this was really difficult to kind of motivate the staff. So I thought, what could I possibly do for this? And if you could just go down a little bit, Ranjita, that would be great. I felt, why don't we try this? If you can stop there, thank you. Why don't we try wearing a particular accessory, something small? So hair clip, tie, earring, not something outrageous, something that was professional, but something that could be noticed. And it was really interesting because the staff thought, oh, this is different. Let's give it a go. So every Friday, it ended up being a different color. This is the reason why it says rainbow at the top. So one week we had red and then orange and yellow, and those different themes that came about with it. So one afternoon we did a 5-minute session on a laughter CD. So you would play essentially a CD of people laughing. And it started off with everyone looking at each other thinking this is very odd. And then we just couldn't stop laughing. And I thought that was really fun. We had a time when people brought in orange colored food. It was really nice because the staff ended up feeling part of a team, feeling less stressed. The dispensing errors went down from a kind of quantitative point of view. And in fact, what was really strange is after doing the red theme, the first session, my boss took me into the office kind of stern-faced, and I thought, gosh, I'm going to be in trouble for this. And she started off saying, you know, that thing that you did on Friday? And I thought, uh-oh. And she said, can we do a lot more of this, please? And I said, okay. So she updated my job description and ended up being, this was something that I did. So I think what's really important here is if you are going to, what I felt was if I was going to make a difference for the team to give better care, actually, why don't we do it in a way that makes it a bit more fun, but makes them feel part of something bigger? I think this was a really good thing. It snowballed and became something that went on for months, actually. So although it was meant to be 7 weeks trial, ended up being about 3 or 4 months. So thank you. Could I have the next slide, please? So I think if I was thinking about how my life has changed, so I talked about the poetry for the pharmaceutical journal, and actually this opened up multiple avenues for me. And you can see the covers of different publications where my poems have now been submitted. I think I have a total of 7. You can scan through a little bit more if you like, Ranjita. A few more places where I have connected with a writing community that's just changed my entire life. So whether it was Covert magazine or at the bottom right, the Studio Ghibli, they show sort of Totoro, if you've watched Japanese anime, themed competition, or Powder's Press, which was launched for an LGBT online zine, which was really fabulous. And then some of this actually allowed me to have a photo shoot. I think one of the bits that are coming up, you'll see, Ranjita, if you just scroll through, that would be great. And it was really nice to be able to be part of something that was creative. For me, this just made it affirming. There was something validating, there was some validation I got out of writing words on paper that I'd never done prior to 2020, and has spiraled into something that's been really quite wonderful and affirming. It takes the edge off a difficult time and difficult work that we do, whether it was face-to-face with patients, whether it was working at a time where life was hard. I'm really grateful and glad that I was able to be part of this. So I haven't put my contact details on here, unfortunately, but if you want to get hold of me, that's not a problem. I suppose if you join the Pharmacy SIG, we'll probably see each other virtually or in person. Thank you very much for listening to me, and I'm going to hand over to Sandeep.
Thank you.
Thank you very much, Ameet. Sorry. Yes.
Thanks, Ranjita and Ameet. Oh, okay, cool. My name's Sandeep. I'm a pharmacist for Black Country ICB. And before I talk about poetry prescribed, my actual art or creative talent, because I think we've all got talents, is around drawing. I'm more of a visual artist, even though I'm going to talk about poetry. Back in, I think it's 2022 or 3, I was going through a really rough period of time. So my health wasn't too good. My mental health and my well-being wasn't too good. So I got back into art, and it's been around 30 years since I last produced anything. And I really enjoyed it. It gave me a passion, gave me hope, purpose, joy. And you can see that I've put myself on there, but I've put art first, even though I'm a pharmacist and I've been practicing for almost 30 years and I'm involved in healthcare. My art and my creativity comes first. So it helped me hugely. And what I did notice was, unless I produced art to give as a gift or it had a purpose, I wouldn't necessarily find it a time to do it, to be productive, to think. So I thought, how can I triangulate health and pharmacy in art? And I Googled, and that's where I found the National Centre for Creative Health. So that's how I got into this. And I want to use my creativity to help people. And also I'm a pharmacist, so rather than just using tablets and biological interventions such as medicines or drugs, how can we use art to do that? Thank you. So I'm going to talk about poetry now. And what happened was I came across an application for the space, and they wanted to commission a digital project that had a creativity around it in order to capture patients or people, and they would have an immersive or interactive experience. And we as an ICB or the NHS haven't got that skill set. So I thought, actually, I'd like to apply, but I don't have a portfolio to help them. But Dr. Ananta Dave, who then was our chief medical officer, she wrote poetry. She had a portfolio. She's even produced a book, and I put a link there. It's on Amazon. It's called An Agony of Hope. It's a collection of poetry, and I put a synopsis of what the book is about. But essentially, it's a collection of poetry about people that are suffering mainly, and the fact that you've got a ray of light or hope or joy at the end of it, maybe, or through that circumstance. So she's emigrated from India. She's worked in India, and now she's over 20 years. She's worked in the UK. She's seen clinicians struggle. So her collection of poetry was different. It was around also the clinicians rather than just the patients that we all see in a hospital environment or GP practice or wherever we work. And she also spoke about losing her loved ones, such as her mom or a dad. And reading her collection, it made me see that at times of angst and when we're suffering, there is hope and joyfulness through it. So you can still appreciate an element of it. So I thought, hang on, let's use this poetry. It can help patients. Let's get it out there in a digital format because it's more accessible. You can use social media. And the NHS plan, the healthcare plan, it's around converting an analog form to a digital form, prevention rather than treatment, and having a community space in order for that to occur. So that was on my radar, and I applied using Ananta's collection of work. Next slide, please. Forgot to say also that if you do purchase Ananta's book, all the proceeds go to Doctors in Distress. I forgot to say that. So I applied via the space. They paired us with Simone Smith. She's actually a poet in Sandwell. She's multi-award winning. She's performed live on stage. She's published a book. And again, I put a short synopsis. Her idea was around using the voices within Sandwell, which is the place within Black Country where I work, using their voices to create a narration to inspire and foster a sense of community pride, and using perhaps a digital format through an app or a QR code to release that. So there were some similarities. So they paired us jointly together and they gave us a commission in a sense. And this, what I'm talking about today, is more of a proposal. So we're still working up the idea, hasn't come to fruition just yet. But the space have helped that massively. Things that I know not of, which is a lot. They've helped us out with the digital side, the idea, how we can distribute it, how that we could produce it, the proposal, the legal side and the ethical side, the unique point of the solution that we've got using poetry, and how we can leave a legacy. And you'll note also that a lot of my language is very scientific. So I've done this for a personal thing to make myself more natural and flow how I was born. And I feel that the pharmacy profession has slightly pigeonholed us. So you see that my writing and presentations can be slightly scientific, and I'm trying to not get away from it, but be more like myself, and my art and creativity has helped me to do that. Also, Simone, she doesn't work within the NHS, and to have her on this project has been a real lifeline. She's given illuminated areas that I haven't even thought of, or Anand hasn't thought of, because she's from a different world, she offers a different perspective. So her interpretation, her collaboration with this project has been phenomenal. I couldn't have done it without, to be honest. And she's given me lots of advice and helped put our proposal together. Next slide, please, Ranjita. So our current proposal, we're still working this up, by the way, and Space actually said, hang on, go to where you would want patients or people to interact with poetry, because you'll get new ideas. So what we've decided to do is, we found that patients or people, they might wait in a waiting room, i.e. a GP waiting room, a library waiting room, in a museum, they might be looking, reflecting. So to use that as a point where they can connect with poetry. So we decided to use a PCN or a GP practice waiting area, and went to that area, to be honest. And really, that's where this idea of using a vending machine and pharmacy came to fruition. It was whilst we were there. So what we plan to do is use stickers or the back of chairs to highlight a QR code that would take patients to an app. And in this practice, actually, the reason why I've got a vending machine is this practice is actually in a gym, and there was an unused vending machine just outside the practice. So we thought, how about an app that patients can then pick how they're feeling off the vending machine, and that then would take them to a capsule or some sort of tablet that would open up into poetry. So that bank, that suite of poetry, be around emotions that they might be having. Oh, thank you. And from that app, perhaps they can create and be signposted to places where they can use their skill set or language to help them form poetry, to help with their feelings. So it's about signposting and also giving them a bank of words to be able to create poetry through a vending machine. I'll come back later on to say how we've got on with this, but that is our current idea as we speak at the moment. Thank you. Next slide, please. Okay, and other ideas I have, which is we're testing this out at the moment. We'll have a proposal. Space will help us design the proposal, put the app together, and we'll test certain things, but we will later on refine the app. It might be that we work this up as a form of research or use different avenues. And the ideas that I've got initially are, hang on, a GP would see a patient. Maybe there could be a button within System 1 or EMIS that they could press that would produce perhaps a poetry in the pharmacy, or on a, I don't know, a piece of paper or on a script, or maybe it's communicated through the spine to the pharmacy, and maybe introduce pharma somewhere, because obviously they produce the medicine. They have a lot to do with individuals, but initially there is a conflict of interest. So maybe we need to overcome that conflict of interest and have them engage with art. So these are all things that I'm thinking about, how we can use community assets, community pharmacy. Eventually, PCNs will be integrated neighbourhood teams. Use that avenue to help patients. In the meantime, I'm attending a prescribing art conference, which is in Greece. And the link for it is on the slide there if anybody's interested. I'm not being funded to do this, the NHS are not doing this, so I'm paying for this myself because I'll get a holiday out of it, and also I'll get to network. So the aim of the meeting is to bridge or to build synergies between the art world and the science world, to highlight research practice, experience policy making, as well as using imagination and creativity that can help people, and how we could test this. Really, it's a case of what the NCCH are doing in the UK, I would say. And this is more, I don't know, maybe global. We will look at medical education and how this can affect the well-being of students and people that the students might interact with. We will look at primary care, how we can influence creativity within the setting of primary care, and also around how science and the health and art triangulate and what policies and how this can influence guidelines that we have within the NHS or wider within the Europe, and I think maybe international, and how we can have enhanced collaboration and communication between us. The proceedings of this conference will be published in this journal, Frontiers in Psychology, and there are keynote speakers there who I can't do justice to their biography, so please click on the link. And I'm going to look at this screen over here because we've got Christopher Bailey, because I can't remember all the words. He's an arts and health program manager from the WHO. Nisha Sajani, she's a professor and director of New York University Steinhardt graduate program, and she's also the chair of the New York Creative Arts Therapy Consortium. And also Dr. Bogdan Chiva, sorry if I've said his name incorrectly, Gurika, and he's the chair and the leader of the social prescribing movement in this country. So those individuals will be there, and I'm hoping I can network with them, speak to them, and also my abstract, which is what I've spoken about, which by the time we go to the conference, I hope will be fully more developed. I'll speak to them about what we're doing in the UK. So that's on the cards for this year. Next slide, please, Ranjita. This I'm not going to read out, but I really thought it was important to put Ananta's biography on the slide set, so you can read that in your own time, because obviously she's put the poems together, she's published, and also the next slide, Ranjita, it's Simone. That's Simone. So her biography is there, and a link to her website. And also, I think somewhere I've included her Instagram link. So those two individuals have been key because they've got the words to inspire joy, happiness, and giving you purpose. And I'm helping out in the background with the admin side of things and how we can get that up introduced and where we should release this. Next slide, please, Ranjita. Oh, and that's just my short biography, and also piece of my art. So that is Ruby the dog. It's now finished, but then it was just being created, and my picture. And I'd be happy to take any questions, or if anyone's got any advice, and when we get to that section, I'll be happy to do that. Thank you, Ranjita.
Thank you very much, Sandeep and Ameet. Really inspiring and moving, wonderful to hear your creative health stories and your practices. And there are some questions, but also we wanted to add Hannah Watterson is here, who used to be part of the NCCH, is now in Manchester. There's a student project that you wanted to share. Is that maybe
Ranjita, if I just come in a second and just say to everyone, just for the last 10 minutes, we'll bring in Hannah in a second, but if everyone doesn't mind, we'll put everyone's camera on so everyone feels like we can ask questions together. If anyone doesn't want their camera on, when I make it kind of live, just feel free to take it back off. The audio won't be on, so if anyone wants to speak, I can just add their audio onto it. So I'm just going to allow the camera for all attendees, so it should work, hopefully. Hopefully it will come on in a second. It may not, maybe. But I'll also just go back. I'll go over to Hannah, Ranjita, and I'll hopefully be able to showcase her, at least her mic. So hold on a second. Okay, Hannah, your mic should be on now. If you unmute.
Can you hear me?
I can, yeah.
Brilliant. Thank you.
I'll add you to Spotlight a minute.
Oh.
So if you want to put your camera on, if you can. If not, it doesn't matter.
Oh, no, it's not letting me do it.
Okay, it'd just be initials. So Hannah, do you want to, Hannah asked us if she could highlight something to everyone in the session. So Hannah, I'll let you talk about it.
Brilliant, thank you. Yeah, that is really exciting to see the refreshed pharmacy SIG and all this interest in creative health. And it's thank you for giving us a couple of minutes to talk about this, because it's really good timing for us. I'm a researcher at the University of Manchester, looking at how we can embed creative health into systems across a whole health and social care system, so not specifically pharmacy. But at the same time, our colleagues in the pharmacy department had been exploring creative health and thinking about some of the opportunities that they might have as well. So I've been working with Penny Lewis in pharmacy, and we've got two really great dissertation students who have decided to focus their final year project on creative health. So we're just sort of at the start of exploring this, and what they want to find out about is what pharmacists understand by creative health, what they think some of the opportunities are, and how they feel about implementing that in their practice and what some of those challenges might be. So we've it's over 2 parts. We've got a really short survey, and the Topsy's going to be doing, and then Christopher's going to be following up with some interviews that will give us a bit more in-depth information about experiences. And I think this group of people here would be a great group to get some of your insights on this. So if you have time just to have a look at that link and fill in that short survey, and if there's a link as well as part of that survey, that then sends your details to Christopher if you'd be interested in doing a quick interview with him. And of course, feel free to get in touch with us directly as well. So brilliant. Thank you very much.
Great, thanks, Hannah. So Hannah, if you want to pop that link back in the chat, for some reason it isn't allowing your advert picture to go in, but we can send that out with the recording afterwards if you want
that would
to.
Be great, thank you.
So I'll just
Thank you very much, Hannah and Alex. And so we have some final few minutes for questions or any thoughts. It's lovely to see everybody, and it's so nice to see some people I've known from the past. And lovely. Hello, Kat. Look, is my line manager from when I was at University of Reading, and where I started this creative health for pharmacy from. So lovely to see everybody and people I've worked with who are involved in that the exhibition, counterculture exhibition as well. So any questions for Sandeep and Ameet and myself, or thoughts? Now's the time.
people can raise their hand if they want to, or just unmute themselves and you know, feel free if anyone has any questions, or even want to share what they're doing in their work as well. Then you know, this is the we've got another 5 minutes if anyone wants to, or raise their hand. We can try and unmute you. Don't know if anyone is. No, I don't think so, Ranjita. Doesn't look like it. Oh, we've got one.
Kate.
Kate.
Oh, hello. Hi, Kate.
I'll just add you to the spotlight, Kate. There we go. You're going to be on, allow your mic. There we go. Try that. Unmute yourself, Kate.
Oh, it worked. Hello.
Yeah, there we go. The power of technology.
Hi, I'm just wanted to say how much I enjoyed hearing all these different forms of creativity that's in the pharmacy world. It's brilliant. And I was very intrigued by the vending machine. And I just wondered if, Sandeep, you wanted to just tell us what happens. Did it work? Have you done it?
No. So thank you, Kate. This is just a proposal at the moment. So we have to submit, and then we would do the work, else somebody else put the app together with a vending machine idea, and then we'll have KPIs, we'll evaluate. So that'll be after. So I can come back again by all means and then explain what's happened and what kind of outcomes we've had, and if the patients enjoyed the poetry and if it helped them.
It reminded me of these. I don't know if you've ever had a batchie, but they have poems. They have poems about love in them. Yeah. So when you unwrap, your chocolate, you get a little kind of poem, which is a really nice thing. And you also obviously you get the chocolate. But so this one says, live on camera, I'm going to tell you. It says, I wonder whether the stars are set alight in heaven, so that one day each one of us may find each other again. Oh. And then you get to eat the chocolate.
Oh, that's awesome. I hope they're available on Amazon. Now.
I got these. I've just been in Italy, so this is
Italian.
So, yeah.
Oh, thank you, Kate.
All right. Thanks, Kate.
That's beautiful. Thank you.
We've got Penny who'd like to come on, so I'll just spotlight you, Penny, and then I will unspotlight Kate if that's okay, Kate. Okay, Penny, do you want to Oh, I might just need to make you unmute. Hold on a second. I'll just allow your mic. There you go. You should be, if you unmute yourself, you should be able to speak now.
Hi. Hi, thank you for today. It's so inspiring. I really enjoyed listening to all the work that you're doing. What I was really interested in, because my role is also part of the NIHR Patient Safety Research Collaboration. So my research is in medication safety, and then I've got into creative health through thinking about creative inclusion and creative methods, and that's how I've kind of got into it. But Ameet, you talked about how like errors kind of went down in dispensary, and that's fantastic. And have you kind of shared that work? I'd love to know more about that.
I think it wasn't something that we essentially recorded in a formal way. It was pretty well much how things evolved. The initial, let's put it this way, I did it on a whim just to see if it would work. I didn't expect it to work as well as it did. What was really apparent is just how it was noticeable from before to during and then after, more so from the rest of the hospital, understanding that this is what the pharmacy team now does, and everyone else wanted to be a part of that. I felt that more than anything, rather than just the errors going down or that people were able to just do the work in a more kind of relaxed manner, it felt like the pharmacy team physically, which was kind of very away from the rest of the hospital, felt actually part of the hospital as well. So there was something about connectivity, which within the team was going down, going up, and then there was just a better kind of feel for it. I wonder if the patients noticed it. I can't remember off the top of my head, but I felt that where we had certain things that were kind of different, people might comment. I think but it was a great scheme. It worked really well, and when the fact that it ran more than 3 months for 1 year, and then we kind of dampened it down because people wanted to go a little bit too much, and said let's just leave it, and then it got revamped a year later, which was fabulous.
Yeah, no, it sounds fantastic, and I think it's really overlooked, isn't it, that importance of connectivity and belonging and working as a team. Thank you.
Thank you.
Great, thank you, Penny. Anyone else have any questions or thoughts or feel inspired by what we've seen today? I'll just unspotlight you, Penny, if that's okay. Anyone else? I can't see any hands.
No, but it's been really wonderful, and thank you so much. It just shows there's already a lot going on, and by just coming together, we're finding out this is something that is growing. It's real interest, and it's going in lots of different directions too. Really diverse and very exciting. What well-being and positive working environment can create for us as practitioners, and also our patients and our public. So there's something about that humanizing, pharmacy practice, and also our kind of way we learn, our education, our research, the way we do things, really important. And any final thoughts? I know this is Friday, but probably the next steps, please, if you're interested to become a steering group member, please do apply, and we will be holding more regular events. And also, if you would like to share or present your work and not be part of the steering group, but just do come online, and we can do that for you as well. And or thoughts that you have about this group and how you think how this could evolve, we're really welcome to have your thoughts. So you've got the email for Alex, and also we'll share the slides, and you'll have my email as well.